Good evening, everyone. Welcome back to News Channel 5 Plus Open Line, where we are asking the experts of Foundations Recovery Network. And joining us all this evening is Siobhan Morse. She's the Division Director of Clinical Services out there, and just really trying to educate us tonight, listen to any comments, stories, concerns you have. She's here to take those calls, and we actually have one already, so let's get to that here on line 2. Can you hear us okay?
Hello.
Wonderful. Hi, what's your question tonight?
Okay, I want to ask this. How great is the need for addiction? I mean, like, what's the percentage of people? This is 1 in 2, 1 in 10, 1 in 100 people in our population that deals with this addiction disease. Do you have to have doctors, psychiatrists, or what kind of skill set do you have to have at a treatment center like you're having? And I've seen this great work. I've seen people come through recovery before and after, and I'm very touched by that. So that's, and then how do you get paid? How do we get the resources to pay for something like this? It's very expensive per month.
It is.
That's a great call, and thank you for calling in. Great question. Siobhan, I'll let you just take it from there.
Okay, so how great is the need? The government does a series of studies based on the census, and think of it this way. If you live on a house, if you live in a house on a street that has 4 other houses, in at least one of those houses, one of those families is going to have someone who has a severe enough substance use disorder that they need to go away for treatment. Okay, so that's how big the need is. So what I heard in the second question, I think, was asking some of the things you want to look for when you are looking for treatment centers. Right? So, and who can treat. So you want to look for treatment centers that have licensed therapists, right? State licensed, master's level preferably. You want to look for treatment centers that have a medical component, that have some form of a doctor or medical director that is also participating. And really important is that all of the team members, so the therapists, the doctors, the regular everyday staff that interact, with the patients on a moment-to-moment basis, that they get together regularly, and that they have meetings, and that they talk to each other, and that there's a discussion about each patient's case. Some of the keywords that you want to look for as you're looking on websites are individualized treatment planning. So it should never be cookie cutter, that everybody gets the same thing. Every single person is different, and every single person comes in with their own needs. And so the assessment for those needs, at the front end, and then being able to address those needs. So when you ask about what professionals are important, you could also, pastoral care is important for some people. That's going to make a difference. For some people, you want to have a trauma expert, because that's going to make a difference. You want to look for programs that are able to meet a wide range of different needs and provide a wide range of activities to meet different people's needs. But again, that have a foundation of a solid, program that is evidence-based. So, and then finally, I heard you talk about resources, and that's one of the hardest conversations. So Tennessee just pulled down a great deal of dollars from the federal government to help provide and support treatment for patients who can't afford or don't have insurance. So there is availability. And in fact, part of our commitment at Foundations is if you call us, whether we're the right fit for you for whatever reason, financial, psychological, whatever, or not, we're going to help you find a resource so that you can get the treatment you need. If nothing else, every caller is going to get hope and help.
And that's a wonderful element that not a lot of places would provide. We have another call. Let's see here. Kelly on line 3. Hi, Kelly. What's your question for us tonight?
Good evening.
Thanks for calling in. What can we help you with?
Well, I did want to bring up genetics. I was fortunately diagnosed that I have what's called porphyria, and there are 8 different ones. It is a medical condition, which my mother had it, and we were grateful to get a grant and work together with Columbia University up in New York, and I got diagnosed matching my mom's mutation. I know this gets a little medical here. And mine came back as a match in 1997. I have great doctors. I have a wonderful team of doctors. I have medical symptoms, but I also have psychosis as one symptom. And that's the part where we get tricky. So I guess basically my question is, yes, I've lived with this. I'm also photosensitive. A lot of things will trigger it. I know what to avoid and stuff, but when it is genetic and in the brain and it affects your central nervous system, I guess my question is, are you familiar with porphyria, for one?
So that would be further down the spectrum that what we would offer at Foundations Recovery Network. But again, if you were needing help and you were to call us, we have relationships with many, many larger facilities that would be able to help you with that.
And Kelly, was there a second part to that question?
Basically, is, you know, I live mindfulness. I've learned my techniques. I have the tools inside of me to use, my breathing techniques and all that, because I do have PTS. And basically, it's just the emptiness of another person, not that they have to know about the disease, but more of a companion. I live alone for 17 years, so I'm a little bit limited, like getting out. So I guess I was wondering if there were some resources that touch with like a caseworker.
All right, Siobhan, I'll let you take that over. Thanks for the call, Kelly. We appreciate that. So
that's great.
What are some of the resources for someone like Kelly?
So they're going to be, that's probably going to be more of a state question. Okay. Again, if she calls, we'd be happy to put her in touch with, for example, the Tennessee Red Line, who could maybe find the resources and help her with that. But I think what's really interesting that she brought up is the genetic component. And that, you know, they actually have now tests that you can do to look for addiction risk scores, which is really interesting. But the truth of the matter is, there is a genetic tendency towards addiction disorders, towards substance use disorders, and they show up in really different ways. So two things Kelly brought to mind are both that genetic piece, which I want to kind of continue with for a minute. So for example, well, you may have like, oh yeah, great Uncle Bob, yeah, he's the one that always drank too much at every party, or he was always, you know, that doesn't mean that the people who end up with the genetics in that family that predispose them or lean them towards it's going to be about drinking. It could show up in so many different ways, you know, especially with young adults and our youth now. It could show up as an internet or a game addiction. It can show up in a number of different brain pathways, including some depression and anxiety type disorders, as well as some impulse control, you know, risk-taking disorders. So the genetic piece is really important. The other piece that Kelly brought to mind is the importance, we had mentioned it earlier, of dual diagnosis. Substance use disorder and mental health disorders often co-occur.
Really?
And yeah, that's actually very, very common. If you, it's just a really simple way to think of it is if you kind of go through life and you notice that everyone seems to feel or look or act a certain way and you never feel like that, it's really easy to get in a position where if you do, you know, when you're 15, everyone takes risks, right? And so you do that first thing and it makes you feel better, and now, wow.
Almost
now,
like a coping mechanism.
Yeah, well, now I feel like everyone else seems. And so, you know, everyone else can stop on Monday, yet you can't. That type of thing. And so they do tend to go hand in hand. They're very similar pathways in the brain as well. And then finally, the other thing that Kelly brought to mind is just the isolation. You know, one of the the hallmarks and characteristics of substance use disorder, especially in the co-occurring population, is that hopelessness and that isolation that can come with it. And you know, you never have to be alone again. Like, you can reach out, you can get help. Like, there is help. It is possible. Change can happen, you know?
And when you receive the help that you are talking about, there is, of course, an outcome. And that was going to be my next question for you. Let's talk about those outcomes, the bright side of this.
Absolutely. So, yeah, the good news is we do recover, right? The good news, so Foundations Recovery Network has a program where we have been for years following up with our patients in a scientifically sound manner and producing one-year outcomes. Like I said earlier, I'm proud to say that our outcomes exceed national averages, and they actually meet scientific criteria. The Substance Abuse Mental Health Services Administration in Washington sets forth some criteria so that we can know whether or not we're representing enough of our patients to be able to say these truly are the outcomes from us, and we meet all of those criteria.
All right, well, coming up after another quick break here, we're going to be talking about risk factors for addiction, how common it is to deal with addiction, and we're also going to talk about opioids. So just keep it right here on News Channel 5 Plus. We'll be right back.